Okay, well, let us start. Pallavi, let us start.
Yeah, thank you, Dr. Rajni, and good evening and hello everybody. Thank you all for making time. Amazing initiative. I would request you all to go on mute because I can hear a resound. Thank you very much. So, Smrutira Odisha International Trust is conducting, as we all know, COVID vaccination sustainability discussion, and we have some very accomplished speakers who have taken out time to discuss and provide us their thoughts on the same topic. So, in the interest of time, it will be my humble request to everybody to not extend their speech for more than 2 to 3 minutes because we have around 20 plus amazing people who are going to speak. So with that, let me get started off. And Rajni sir, Sulata ma'am hai yahan pe? Sulata Dio ma'am.
Yes, Sulata Dio madam is coming after some meeting is going on. So okay, after some time she'll definitely come. She already said message to me that will definitely come.
No problem. So while we wait for Sulata ma'am, let's move on and move ahead with a speech by Mr. Ramchandra Das Mahapatra, who is our chairman, and Parasthi Daitapuri. Hello, sir, are you there? Yes, I think so. You're on mute. Hello, Mr. Ramchandra Das Mahapatra, can you unmute yourself? Hello.
Hello.
Namaskar, Jai Jagannath.
नमस्कार, जय जगन्नाथ, जय जगन्नाथ। स्मृतिरा उड़ीसा की सबकी सदस्य को हमारी बधाई है। अभी कोविड-19 का टाइम में प्रभु जगन्नाथ जी का आशीर्वाद सबको मिले। हमारी रजनीकांत जो प्रोग्राम कर रही है उसको भी हम लोग धन्यवाद देते हैं। हमारी जो प्रोग्राम है उसमें जो सब शामिल है, हम सब मिल के आगे कोविड उठने के बाद पूरी में एक फंक्शन करने के लिए रजनीकांत हम सब मिल के करेंगे। उसमें जो कुछ चाहिए हम सब करेंगे जगन्नाथ जी की कृपा में, और हमारी प्रोग्राम को आगे बढ़ा जाए। जय जगन्नाथ।
जय जगन्नाथ जी और रामदास महापात्र जी, जगन्नाथ जी को याद करके प्रोग्राम स्टार्ट किया। शुक्रिया। एंड मुझे पता है कि जगन्नाथ जी हम सबकी मदद करेंगे। Thank you so much, sir. So moving on, I would like our rock star, Mr. Dr. Rajnikant Mishra sir, whose credentials are endless, to please start the program with a few words. डॉक्टर रजनी जी प्लीज। हेलो, आपकी आवाज नहीं आ रही है।
हेलो।
हाँ, हेलो सर, वी कैन हियर यू प्लीज। हाँ
रजनी बाबू बोलो।
And welcome to the very beautiful topic, and today is the last year's like the great pandemic COVID-19. We are suffering so many things and lost on so many things, and pray to pray to all the lost of the people of around the world who was the like of eminent personalities and all the different categories and worldwide, not only India, from all worldwide. I am convey the message to my like of moderator to 2 minutes. Just pray to our those lost our family, lost our parents, lost our children.
रजनी सर, आपका सिग्नल कट रहा है, बट Absolutely. Yes, sir. Your signal is getting.
अभी हो गया?
हाँ, अभी ठीक है. So, as Dr. Rajni has just said, let us observe a minute's silence for those who lost their loved ones.
Suddenly, only 2 minutes. Only 2 minutes.
Yes.
And,
welcome everybody. I am Dr. Vanambar Sanapati from Puri. The audio is not good. We are not able to hear.
Rajni sir, your audio is not good. I believe there's some network issue. So thank you. Thank you, sir, for those words. And yes. Moving on.
Hello.
Yes, sir, your signal is not, we cannot hear you at all. I still can't hear you. Yes. Sir, कुछ सुनाई नहीं दे रहा है. Yes. Sir, you're very inaudible. I'm so sorry. I hope that somebody can hear you, but so you're absolutely inaudible. I'm sorry that the signal is very bad.
Hello, ma'am. Hello, ma'am. Can I talk? Myself,
yes,
Myself, Dr. Pradyumna Kumar Behra. For the first time, I am joining in this panel. I am the retired CDMO in New Delhi district, and now for the first time, I'm joining this panel, and all the respected members of the panel, and my dear respectable audience, those who are listening to our talk. And the topic is very interesting one, really. Before that, I pray God to bestow upon the mercy upon the whole humankind, which has been devastated by the cruelty of this COVID pandemic, and the lamentation of the millions of souls that is vibrating the atmosphere. Oh my God, rest them in peace. And prior starting any topic, just I have ventilated, I have expressed my gratitude to these departed souls. That's all. Jai Jagannath.
Jai Jagannath, sir.
I am from Odisha also.
Thank you, sir. Yes, thank you so much. I know a lot of people.
Jai Jagannath. Jai Jagannath.
Jai Jagannath.
Jai Jagannath. Jai Jagannath, sir. Thank you so much for that beautiful start to the program. So I would like I would like to invite Mrs. Zahida ma'am, who is our president of Smrutira Odisha. And she's a wonderful person, very driven person. And ma'am, can we have a few words from you if you're on the call? Okay, I believe that Zahida ma'am has not joined. So next, I would like to invite the very vivacious and the very multi-talented Prasanapati ma'am, who is our senior director. And you have to hear her speak to know how accomplished, talented, and driven she is. So, ma'am, on to you. Over to you, please.
Thank you very much, Pallavi. Warm good evening to all the delegates, all the speakers and audience and guests out here. I'm Prasanna Pati. And yes, first of all, my gratitude to the all demises who lost their life in their family and friends. My sincere gratitude and condolence to them. Smrutira Odisha Charitable Trust is established in the year 2014. Every year, it organizes state-level children festival supported by Government of Odisha Tourism and Culture Department. Smrutira Odisha has its first old age home at Baripada, Mayurbhanj district. Second old age home has been already inaugurated in Puri. One of the kind life member of Smrutira Odisha has donated 6,000 square feet of land where the Bhumi Puja has been done in the month of November, very recently. And this old age home has been planned with 40 rooms with all modern facilities and amenities with medical facilities and entertainment for the old senior citizens. Every year, Smrutira Odisha organizes annual function and bhajan samaro and our ceremony for singers, social activists, and other eminent guests during the car festival in Puri. Smrutira Odisha is massively active during COVID-19, and today also we are a part of the same drive, which Smrutira Odisha is relentlessly working day and night and is involved and trying to help in its own way to support and to spread the message and to create some more awareness so that we can save some life and we can break the chain of this COVID-19. So during this COVID-19, Smrutira Odisha has extended its support to the migrant workers below poverty line by providing dry ration, masks, and sanitizers to many people. Smrutira Odisha Award 2019 in support of MSME Department, Government of Odisha, Government of India was a great CSR initiative in its own field. Smrutira Odisha has 23 state life members working in and around in different places like Indore, New Delhi, Bangalore, Chennai, Bhubaneswar, Uttarakhand, Haryana, Mumbai, Pune, Uttar Pradesh, Jharkhand, West Bengal, Goa, Bengal, Gujarat, Chhattisgarh, and the list is really long. All the life members are responsible to do something better for the society and some charitable work to enhance the better being and the better living in the society. Smrutira Odisha is also not a national platform. It is internationally connected with other countries also. For example, it is having its offices and people working in US, Chicago, Malaysia, Sri Lanka, Colombo, Nepal, Finland, Holland, Singapore. And again, the list is increasing every day and the list is getting added. I'm really proud to be a part of Smrutira Odisha, and today's initiative of doing this drive, actually in today's days of social media platform, we all are aware of many things. We are flooded with information. Still, it is another initiative to help us and our surrounding a bit ahead to take care of ourselves and our family and friends during this COVID, during this pandemic, and to overcome this situation and see a better future. With this, I will thank to Pallavi and all other for giving a patient hearing to me. And thank you everybody. Have a great evening ahead. Over to you, Pallavi.
Thank you, Prasanna ji, and you have very concisely put together the work that Smrutira Odisha is doing, and I'm sure that the list will grow even longer. So thank you so much for those beautiful words, and I would like to invite our National President, Mrs. Sangeeta Mahapatra ma'am, if she's on the call, to speak a few more words about the work Smrutira is doing. Hello, Sangeeta ma'am, are you on the call? Okay, I believe Sangeeta ma'am is not on the call. So yes, I would like to re-invite Dr. Pradyumna Kumar Behra sir, or rather officially invite him again. I know he's said very beautiful words right before we started off. So a bit of introduction about him. He is the ex-CDMO New Delhi, and he has made time for us today to provide his thoughts. So yes, sir, thank you so much, and over to you once again. So I think you'll have to unmute yourself.
Yes, thank you. Thank you very much. So whether we'll come to the topic or because I am new to this Smrutira, what is Smrutira, can I just
Smrutira Odisha.
Nomenclature, Smrutira Odisha. Acha.
I think you're on mute again, sir. Can you unmute yourself? I'm sorry.
Yes, sure. Okay, thank you. So, ma'am, now we'll start regarding this topic, this COVID-19 sustainability or anything else.
No, we just want to hear your thoughts about what do you think of the vaccination that's happening? Is it sustainable in the long run? Do you think that it is good enough to fight back the epidemic that we are going through? What are your thoughts on it?
Yes, ma'am. In so vast populous country, we are having a population about 1.3 billion people. Mass vaccination of a so enormous number of people in a vast geography, it is a really very Herculean task. So after this raging and treacherous second wave of COVID-19 pandemic, this vaccination program has become a challenge, unprecedented challenge. Still, we have not left the courage, and we have a robust planning for that. And the need of the hour is we have to make a strong framework how to the first and foremost step is the digital platform for the registration. But there are certain lacunas in the digital platform because it makes a digital divide between the digital technocrat and the poor marginalized people, the common man. They don't know about this technical aspect of this digital world. So there should not be any disparity between the common man and the technocrats. That should be abolished. And the platform, digital platform should be in such a way that it should be user-friendly. So, and all these NGOs, other organizations, they should pitch up in this drive so that they can help in registering the going up for this vaccination program. That is one thing. And there are so many volunteers. For example, that is Robin Hood. This Robin Hood that is from Bombay organization. They have helped in registering about 140 cities, about so many senior citizens, because they are not aware of all these technical knowledge how to register in this vaccination program. So in many ways, they are helping to the common people. And second is how to just procure the vaccine and its distribution system. That is also most important thing. Procurement of vaccine also is a arduous task in the sense, and comparing to the demand, the manufacturer of these vaccines, they are not able to supply. So this mismatch is leading to a vaccine challenge and vaccine crisis. So the government, the policymakers, they should look into this matter. That is one thing. And another thing is how there is a deficit in cold storage, cold chain infrastructure, and the transit of all this vaccine from one state to another. There is an interstate disparity. So that should be also looked into. This disparity should be corrected. That is the thing. And the sustainability of this vaccination program totally depends upon the institutional capacity, financial capacity of this state or the government center. So to boost up all this thing, they should make a meticulous planning for this vaccination program. Okay, ma'am.
Dr. Pradyumna, I have to confess that this was one of the most concise ways of putting all the problems that we are facing together, not as the nation, not just as a nation, but as the entire world. Of course, supply chain is a huge problem because we probably none of us ever thought that we'll need so much manufacturing. And this is something where people have to stay away from each other. It's not like we join hands and we work towards something. It's we break the chain and we work towards it. So it's an unprecedented challenge. So I hope that all of us, like the entire government, does or is able to, with the help of organizations like us, is able to reach out to people faster and also provide for vaccination drives, which would definitely help all of us.
They also the number of the healthcare workers should be also enhanced, and they should also open so many vaccination centers. And there are so many ways now. They have also adopted in Odisha also, on Delhi also, the drive-in vaccination program. It is also very convenient for people, and also walk-in vaccination program. These are the other optional vaccination programs. It will boost up all these things. So all these, to enhance this vaccination program, they should increase the manpower also. All the healthcare workers, staff members, they should be trained and they should participate in this vaccination program.
Yes, absolutely. I do agree. I have seen a certain subset who, for the fear of the virus, did not venture out to help. But if they are trained in something, they should move on and also work with COVID patients to make sure that we do control the virus. Thank you so much, sir, for your thoughts on this topic. It has been a pleasure listening to you and your thoughts.
And the corporate sector also, they are also taking having a vital role, and they can also help vaccinate their employees. The first priority should be given to the employees and to their family members and dependents also. So all these corporate sector, they should come forward for this program.
Right, and it's great to see that corporates are actually working, because a lot of their workforce is also getting affected. So I'm sure that although we are taking baby steps, we are taking the steps in the right direction. So I just hope that it all gets over soon. Thank you so much, sir, for your thoughts. And moving on, our next speaker is the Chief Plastic Surgeon and Director of Smrutira Hospital and Trauma Care. I would like to invite Dr. Akshay Kumar Roth to say a few words. Dr. Roth? Hello, sir. Are you there on the call? Dr. Roth? Okay, I believe we have some sort of technical issue over there. So our next keynote speaker is the ex-director of Health and Family Welfare, Government of Odisha, and the Vice President of the Indian Medical Association. So I would like to invite Dr. Binambar Senapati, sir, to say a few words.
Thank you. Thank you. First of all, I will thank the Smrutira Odisha International Trust for inviting me to tell something. So many thanks. I will thank all president and all the executive body members of the trust. So it is a very good topic. It is a vital topic. At present, this is a vital topic, vaccination and its utility. Actually, only vaccination can protect us. That is a vital thing. So this vital thing, this vaccination in our vast country like India, it is a great task. Nearly 200 crores doses will be required, as it is a population of 140 crores. So more than 200 crores doses vaccine will be required. So that is a great task. So government must be planning how soon and how best these vaccines should be procured, should be produced and distributed. Everything what Dr. Pradyumna Mehra he has told, from the starting from the production side, transportation and this cold storage and to the beneficiary, everything should be well planned. And till as we are seeing there is deficiency of vaccines in our country, so this social vaccination, like your proper use of mask, social distancing, sanitization and cleaning of the hand washing, this should be properly and strictly adhered to by everybody. And we will try how soon and how best this vaccine should be procured by government. This should be produced in our country and this can be also procured from other countries. So prime and vital thing is vaccination should be, that is the only method to protect us. So vaccination, the sooner is the better. And the foreign countries like USA, UK, perhaps they are now in a very nice condition because their population is less. Almost they have vaccinated most of their people. So they are now in a little safer side. So I would propose that this vaccination program should be well planned and this should be available to all the public easily. Thank you.
Thank you so much, sir. I do agree that one of the challenges, the most important challenge is definitely the population of our country. And that makes it even more important for every individual to maintain and social distancing. So I do agree that the government has to work towards planning and providing vaccination, but at an independent level, we all have to also social distance ourselves. So thank you, sir. That was very, very informative. Thank you so much. And I know we didn't get to hear Dr. Rajni speaking because of the very bad internet connectivity. I would like to invite him. Sir, are you there? Please, आपकी बात हम सुन नहीं पाए और हमने प्रोग्राम स्टार्ट कर दिया. प्लीज. हेलो, रजनी सर, आप कहाँ हैं? Okay, I think the internet is still bad, so I'll invite Sir back after a couple of minutes. Okay, moving on. Our next guest speaker is the Director of Liver and Transplant Institute, New Delhi. Please join me in welcoming Dr. Ashok Chaudhary, sir. Thank you so much for joining us. Dr. Ashok Chaudhary, are you on the call?
Yeah, good evening. Hello.
Thank you so
Am I
much.
audible? Yeah.
Yes, you're audible. Thank you so much for joining us.
Thanks everyone, whole team of Smrutira Odisha. I don't know how to go for because till now we are heard the things about vaccinations. I think with me, Dr. Nalin Pati is there. We have done one interactive sessions where we are able to answer the questions what is coming to common man, not the doctors community. So I think if this way we can proceed, we may be of some help to you all. And that may be your agenda, I don't know. But from my side, being a organization, being an individual, or being a part of this India, what we can do. So I can say we should think in the three ways. One is from the public aspects, one is from the. So first I'll come to individual level. The problem is the vaccine now when the second peak has come. But before that, it is not the vaccine. It is the problem of vaccine reluctance. And still now also we are getting a lot of reluctance to accept the vaccines. So we should get sensitized. And there's I can say these two vaccines. One is social vaccine and is the vaccine. So vaccine is what we are discussing. Social vaccine, which is not requires any cost, no appointments, no booking, no gadgets. It is what we should know that our social distancing, our mask and sanitizations. I think over a period of time for last 1 year, we are forget the social vaccine, which is available to you at all the time. So I ensure even before getting vaccine, even while you are taking vaccines and after taking the vaccines, please follow this social vaccine one, that is social distance, mask properly, and sanitation. So what I can say here that the recently study which was published in Times of India, only 7 people are using the mask appropriately. 50% only using the mask. So that is also biggest thing. We should see every individual person is ambassador. We should pass the message to your person sitting next that please pass this message, the mask to write properly, to follow those social distancing and to see the sanitations. You can see the anywhere the public areas. And now when we are going to open up this this process of having lockdown
Dr. Ashok, I think we're facing a bit of issue from your internet. I'm not sure if it's me or if everybody is unable to hear Dr. Ashok Chaudhary.
Has been uplifted. So then that is the biggest challenge to the social distancing also. In that case, this social vaccine, the personal level in civic sense, it is very. Hello?
Hello.
I think he's lost connection.
Yes, I believe so too. Let's just give him a minute.
Sorry, am I audible now?
Yes, Dr. Ashok. Yeah, we lost you somewhere in between.
Okay. There's a lot of problem with this internet. So basically, that is what I am telling you at the individual level. Then if you go to the policy level, I think I'm not the right person. There is big people are here sitting, but we need a policy to make this vaccine available. You can go anywhere in the country. The vaccine is affordable, available, and it is at the reach of a common man. So we should make a policy, and most important is the supply chain, and also that things should be covered by someone else. But our target is that if we think that there should not be a second peak, we should have vaccinated much before. If we are thinking that there should not be no third peak, we have to go very massively for the vaccination right now. So these are the things where the vaccines is a must. And for these vaccines, we have to think proactively in a large and a very time frame manner, because the third peak is imminent in absence of a mass vaccine drive. Then if you come to the level at the public, or what we can say, what we are sitting like Smrutira Odisha, I can suggest to do the extensive IEC activities. We should disseminate the informations, we should educate the public, and we should make communications to the vaccines. Because I have seen some good Samaritans, they are using vehicles, they are ferrying the people to go to the vaccine center. As rightly said, that someone is doing process. Some may vaccine are their own setups or wills to get a vaccine. Just about the
Sure, Dr. Ashok, thank you for your views. And I do agree your internet is unstable, but I do have a question for the entire panelists here. Anybody can answer me. Please feel free to jump in and answer. I agree that we are going for a phase-wise vaccination where people about maybe 45 are getting vaccinated first. So what is the importance of the entire demographic of India that falls under that category to get completely vaccinated before the rest of the groups can be completely vaccinated? Or should they both go in parallel? Anybody can answer it. Please, it's just a query from my end.
Yeah, Dr. Nalini, please, can you pitch in?
I'm sorry, who's this?
Dr. Nalini Pati.
Hello, sir. Yes, please go ahead.
Thank you, Dr. Ashok. That was so wonderful. Even the internet was a little bit unstable, but I could hear and I could feel what you meant and what work you're doing. Wonderful work. So I think I completely echo what he has said. So I think if I understood your question, what should be the number of people should be vaccinated before? Can you repeat that question? I mean, what is the purpose of doing so many people? Is that what you are asking?
No, I'm saying that if you look at the demographics, there are people who are more prone to getting damaged because of the virus. So should we completely get one particular age group vaccinated before we move on to the others, or should they happen in parallel? Because obviously there is a shortage of vaccination.
So when there is a shortage and supply issue, I think it's very, very important to cover the high-risk people, such as people above 75 with several comorbidities. They are the first priority. Then the healthcare workers like nurses, doctors, and other paramedical staff and cleaners. So we should not forget them as well. So we should vaccinate because they are the high-risk people, and people work in the airports. They should be vaccinated as well. So that's, I think, important group. But if there is no shortage of supply, then you can go to, I think as a priority, you should protect them first because they are the ones getting exposed day in and day out. So you should protect them first, then moving. And if there is a facility, you can do that, do in parallel. The other main question people ask, why the gap? So I think in Australia also, the AstraZeneca, which is a cell-driven vaccine, which was the gap was 3 months, which is the three months gap. So the benefit with that, you give more vaccination to more people, and then before moving to the second dose. So that is a benefit. So giving the bit more extra gap. People ask about why the gap will increase in India, but I think there is a scientific fact to say that increased gap does help as well. So I don't think there is any problem. And then if you have mechanism that it can do that in parallel, I think better to do it. But again, lack of supply is the main concern, I think.
Absolutely. So yes, I was looking for some inputs from the experts on that front, because I always had a question as to why we are doing vaccinations for all age groups in parallel, because the risk is higher for some while not so high for the others. And thank you so much. Yes, hello. Yeah, was someone saying something? Okay. So moving.
Sorry, can I add something here? This is Anita here from London.
Thank you, Anita, ma'am. Yeah, please go ahead.
And can you keep the question answer session at the end, because so many speakers?
Okay.
Please always complete the talks. Then at the end you can have a question answer session. Otherwise you are killing time. Already 7:30.
Okay. Definitely. Yes,
So
I do see your point.
So if you could consider, like it's already 12:20 midnight, so past midnight rather. So that's fine. Whenever you can give me a chance, that'll be great. That's fine. All right.
Oh, I'm so sorry for that, Stalpati. So yes, moving on. The next on the list we have Dr. Sandeep Kumar Padjoshi, who is DGP Joint Secretary Ministry of Panchayati Raj Government of India. So sir, can we have a few words from you as well?
Namaskar. Really warm greetings to you all, especially during pandemic. After first wave and second wave, really be safe as far as possible. And the virus is mutating. That's one of the medical danger, and it is giving very clinical problems, right from lung infection to various other organ failure, as reported by various doctors. And even the post-COVID also, after recovery also, there is a big danger. Almost a month or two, one has to be careful. And there is definitely that appropriate COVID protocol has to be followed by mask or distance, and distance up to maybe 1 or 2 meters fine. But indoor it will be very bigger, because the aerosol transmission of the virus, that's one of the latest, people are telling on that. Definitely I want us to also get masked inside if you are having a servant from outside or anybody from outside visiting you at home. And secondly, sanitization of the hand as far as possible. It is not that only one particular half an hour routine, or any time you remember, better to invest or spend money on sanitizer rather than suffering in hospital and spending a lot of money in hospital. So hand sanitization, because normally we touch our face 300 times a day. So even unknowingly we do that, even too much of conscious also will do that. So better to hand sanitize as much as possible by alcohol based 80 to 90% or whatever good sanitizer available in market, and it's very cheap now. Earlier it was very costly. So buying a water sanitizer doesn't cost much. Better to invest money in that. Secondly, now the vaccination program is going on. Definitely there is a lot of even price shortage. Even Supreme Court also, why not one price for whole country? There are a lot of confusion going on, and definitely some private hospital also started with hotel tie-up, let us vaccinate, but it was not permitted by government. That hotel cannot be a place for vaccination. But I have slight skepticism about drive-in. How they are registering those patients at time, because some may be not forgetting that he may be taking third dose also. I don't know. I have not seen particularly where the drive-in vaccination system is there. People just come in car and sitting inside car and taking vaccination. First dose, it is a self-declaration. Whether that is truthful or not, people, the urban rich may be taking extra vaccination than required, because 2 doses are required before the timing also, because the Covax has a gap of around 30. So that may be happening with the basic elite class. I don't know how that's really a challenge point. And thirdly, definitely there is a supply constraint, there's no doubt. A lot of states are going for global tender, but it will take time. It has its own procedure, approval, then testing, various protocols are to maintain before really field trial of vaccination. But one thing one can do definitely to prevent that as much as possible, especially contact points, even during AIDS time. We remember a lot of precaution being taken that don't try to indulge in all bad activity during AIDS because it was also highly transmissible. Of course, not like COVID now, not through air, but it was basically a fluid transmission or transfusion. That's what we wanted. But after long effort of sensitizations and a lot of effort, we have controlled the AIDS now. Hardly any AIDS patient roaming around, very few are there. Similarly, COVID also one of the very strong precaution. It is going on for many years. I think it will be not vanishing overnight. So better to avoid big gathering, marriage party. I think you can, they know, I mean, to be offended or to be ashamed or at least feeling guilty, they're not able to attend a birthday party or marriage party or any other group gatherings, because no point in risking your life. It is one of the super spreader. It has been found whenever large gathering people are there, and they after that happening they repent. Recently also, I think one marriage 100 people got infected and the 4 people already died. In Rajasthan also, the bride's father died, bride's father died. So many other people died because of these crowd gathering, and you don't know who is coming and how infection is spreading in that situation. Better to avoid that. And certain things, of course, I understand new normal in the post-COVID situation. You have to readjust life. Many people just for this fun sake, they go out, do nothing and gossiping with the 4 or 5 people walking on the street. That is not expected now, because maybe you have some mental issues saying that, but activity will be exercise within home or within lawn or something. But rather avoiding public gathering, it's a must. Other people really just, again, I feel again, there is socializing has been, though it is totally not that. And really, this type of webinar will definitely enlighten us and try to teach us in a different way to behave in a different situation. And I wish you all the best. And let us hope all to be safe. Thank you very much.
Agreed, Dr. Sanjeev.
Just one request, please allow Dr. Nalinipati, already 12 there, we should listen to him. Australia already 12 and midnight.
Sure. Yes, Dr. Nalinipati, can you please go ahead? I'm so sorry for keeping you so late.
No, that's all right. No, thank you. And I think people are waiting before me as well. So like.
No, you should listen to you, Dr. Saab. You should listen to you because you are the main part. Okay.
That's all right. That's good. Thank you so much. Thanks to Rajnikant sir for giving the opportunity, and thanks Pallavi for this introduction. And such a wonderful team of people doing wonderful work. So I must thank all the frontline workers and all the supporting people. They are doing the hard work at this minute in India. It's really heartbreaking. And even though I stay this far, I get the messages all the time. I'm into different groups and try to support whatever I could do from this distance. But I know how hard it is for all the families and the friends. This really is a challenging time. It's not easy to say, but I have felt last year when I was there during the pandemic in August. So I felt that, but now it's even much worse than that. So as many people have pointed out, I'll just pinpoint few important stuff. First thing is vaccine. I think Dr. Ashok Chaudhary told very nicely. I don't have anything more to add, but to reiterate the fact that the vaccine is the only solution, I think, at this point. The solution that we have so far are all preventative strategies. And we know there is no specific solution to the virus. Once the virus is infected, there is no. Again, I'm here not to scare you people, but I think this is a fact, which is a fact. Like people in Australia, in US, Australia, unfortunately, we didn't have a huge number of COVID cases, which is good. But look at what happened in all the European countries. What happened in the US? They have all the resources. They can throw any amount of money, any resources, any technology in the earth that is available in the US, right? And at one point, everything failed. And because it failed, because no system is ready, can be ready to handle such a pandemic. That is a challenge. I think preventative strategy is extremely important. I think the fact is mask again. I mean, again, also said, and also other speakers, Pachosis are also said the same thing. I think mask not for the sake of putting the mask. I keep on saying same thing. And what we need to do, as all the doctor people and all the doctor friends, they are there in the group and also outside, there are some structured programs, videos. We need to do those things because even we think we know it, but actually we are not. So mask, there is a way to put it. And it is very clear, if you touch the mask, you are supposed to wash your hand or sanitize. So we don't do that. We put the mask, pull the mask down, start talking again, put the mask back on. That is extremely dangerous because there is a thin layer of viruses. That's why we're putting the mask, right? We're putting the mask to filter out the virus. What we are doing, first of all, the mask should be tightly fitted. If the mask is not tightly fitted, just imagine virus is such a tiny structure, can pass through anything. And if you are not putting properly and there is a leakage everywhere, there's no point. Second, you're putting the mask for the sake of putting it, right? And there is, let's say you're putting properly, and there is what happens. It is a filter to filter the viruses. So there is an increased concentration of the virus at the surface. So you're touching it. So your hand is contaminated. Then you're putting it back and they're using all sorts of things with your hand. So very dangerous to put the mask and not using it properly. Second, I think social distancing, all those things we know very well, but we need to practice in reality. Are we doing it? That's the thing. And coming to the vaccine, there are so many types of vaccine. Yes, there are some risks. Yes, because any drug, even if you take a paracetamol, will have some side effect. Yes, vaccine may have some side effect, but it has been proven. People ask, like, how come the vaccine came out so quickly? It takes 8 years or 10 years to prepare a drug or vaccine. How come this quickly? What they have done a smart approach. They have run all the clinical trials. I'm not talking about India. I think they got through some of those things, but in when the US and UK were the main trial were occurring. So both phase 1, phase 2, phase 3, all the trials were running at the same time. That's why they saved many years while running the same phase 1, phase 2, and phase 3 at the same time, just so that the vaccine can be ready much earlier. Now, I think with the vaccine, what are the benefits? Yes, there could be reinfection, but we know from the studies, we know from all the publications so far, reinfection can happen, but the death rate will be much lower. So people that have had the vaccine, they may, there are instances, I can't deny that people have had the vaccine, there are deaths. People came from the US, they had the 2 vaccines, they came to Odisha to see somebody, their mother, and he passed away. So such cases happening, but that's not the majority. The majority case, what happens? Yes, there could be reinfection, but the reinfection rate is very, very less. And even if the infection happens, that will be less serious. At least, patient won't land up in the ICU or ventilator, and things will improve. So ventilator, again, we say, okay, we need a ventilator. So we need to also understand, are we ready? Are our training ready? Do we have trained staff, trained nurses? It's not easy. Ventilator is such a complex issue. And if people we struggle in Australia, people struggle in the US to use the ventilators properly. So if you are not used properly, so I think ventilator is one thing, but more than that, we need to invest other strategies. People talk about the fungal infection, mucormycosis, black fungus. I think this is just to change. Yes, there is an issue, and we need to understand why the fungal infection happens. We need to go to the root cause. Instead of doing that, what you are trying to do, we're trying to focus on the fungus, saying that yes, black fungus has come. We need to focus on black fungus. We can cure black fungus. Is it curable? Probably not. 80% chance, I'm just exaggerating, maybe 60% chance the patient will die, because the drug that is used for black fungus or mucormycosis is quite expensive. One vial, probably Dr. Akhya or Dr. Ashok will tell the exact figure, but I think it is to the tune, one vial would cost around 7,000-8,000 rupees, one vial, or maybe a little bit less, I don't know. But I think such an expensive therapy, and the therapy will go on for months, 2-3 months. So can we afford it? what we can do to prevent the black fungus or mucormycosis. I think we need to understand we should not be using all the antibiotics so rampantly. We use azithromycin like water. We should try not to use azithromycin. There is no role. I mean, unless there is a pulmonary fibrosis, there is no role of azithromycin. So we should stop using antibiotics rampantly. Stop using steroids unnecessarily. So when there is a respiratory problem, when the doctor says that yes, you can start the steroid, yes, please do, but not going to the shops and getting the steroids. As soon as you got a COVID test positive, you start the steroids. So what it does, it suppresses your immunity. As such, we are struggling with the viral infection. At the same time, we're taking antibiotics. So virus is all the food for the virus. So the fungus. So that's the problem. What also, I think one other thing I would like to highlight here before I finish, I don't want to take much of your time. For the doctors, are we supporting enough the medical staff? Are we, as a health policymakers, are we supporting all the medical professionals and the paramedical staff? What are the support I am suggesting here? Like when there is a pandemic like this, it's a high risk for the doctors to see many patients, right? At the same time, are we investing we are very good at IT. Why don't we invest and try to increase number of telehealth medicine? Like easily said than done, but I think certainly this can be done. People can invest, and hospitals should invest more in the telehealth. So instead of patients coming to you, and they can do telehealth and in a proper way. And also a regular training of the staff and the nurses is very, very important. Similar simple stuff. And another example I'll give, there should be 2 or 3 teams within the same team. For example, one hematology team. I'm giving the example. There should be 3 or 4 teams amongst the hematology. They should not be talking to each other. So there should be a handover by virtual means. So one team goes, they see the patient, they take care of the patient, they go home or whatever, wherever, but they don't come in contact with the other teams. So there should be small teams, and that should be formed. Hospitals should have a structure that everybody should enter into the hospital should be screened properly. So those things we need to do more and more so that we can break the chain. And unless we break the chain, this is going to continue. I think we are in such a huge population country. I think we need to do, and everybody has a role. We can't blame government, we can't blame the health professionals, we can't blame a hospital. I think every single individual has a role, and we should do our role properly. Hopefully the pandemic will be over soon. I'm really saddened. We are doing a lot of fundraising, and we are trying to support, I can say here, and Chidatumika Madam is there, and we have generated some funds. We'll support her organization, and similar other organization also we are supporting for organization, and all small bits whatever we can do from here. Namaskar. Thank you.
Thank you so much, Dr. Linpati. That was very insightful. And yes, we all have to take care of ourselves. So I would like to re-invite Dr. Akshay Kumar Roy.
Sorry, I made it very serious. Sorry about that. Sorry, my sincere apologies. I made it very serious.
No. So yes, can I have Dr. Akshay Kumar Roy, the Chief Plastic Surgeon and Director, Smrutira Hospital and Pharma?
Namaskar, Jai Jagannath. I am Dr. Akshay Raut, plastic surgeon. And today's topic of discussion is the vaccine and its utilities. I'll tell a few practical points I learned and experienced over these years. It's like a reporting from ground zero. What is happening in a country like India, vastly, hugely populated, unruly, indisciplined populations, and doesn't understand anything ABCD about medical science. So the country where this type of population is available, it's very difficult for any government or any organization or any hospital to deal with this. What is happening right now? As a policy matter, Government of India proposed that to first line COVID warrior, they will get vaccinated. And then second phase, they planned for the older populations, like 50 to 65 years. That may be a right policy at that time, but in the long run, it looked wrong, because in second wave, Is it audible?
Yes, we can hear you,
Yes, audible.
Doctor.
Is it audible? In second wave, everybody got infected. Everybody. Even young generation getting more infection and they are dying like insects. We are experiencing here. Leave about USA, Australia or Europe. They are small country and all total North, South America, Australia and Europe, that is India. So here to control that COVID by vaccination is a Herculean task. So for the government of India, only thing is, one thing is availability, other thing is awareness, third thing is to cut the phobia. During the first vaccination period, what happened? Many vaccines has been destroyed. And our medical staff, nurses, they didn't go for vaccination because there is a political misinformation that vaccine will cause impotent and people will die. Even our staffs, till now, they are not getting vaccinated, fearing that they may die because of vaccination. Yes, there is some complications, so it may happen. So by screening, if it is found that he or she is not fit for vaccination, then he will be discarded from vaccine program. But the wave of phobia is created throughout India, so they didn't go for vaccination at all. In my hospital, my ward, 20 nurses, they decided that they will not go to vaccination. Once I'll take, if anything happened to me, then only they will go. So this is the situation that time. That time, lots of vaccine was destroyed. So and second wave, when the young people started dying, so everybody become panic and they will go for vaccination. Term, what happened? During queue, they got infected. Even after 2 doses of vaccinations, people are getting second infection, what we call is breakout infections that will happen. And people are also dying after taking first wave COVID, got cured. In second wave, after 2 dose vaccination, they are also dying. So vaccine is not 100% foolproof. That will save you. Yes, vaccine has a role that will decrease the mortality and death rate once you get vaccinated. This is the thing. So third thing is, now my point of view is the policy matter. What government of India or our state government should do, vaccine for everybody. Everybody must have remembered in 1970 or 75, the vaccine drive was for smallpox. Means who will get vaccinated, they will get 500 rupees. Like that only, if a community and cluster vaccination program, government of India will try, then 100%, at least if you achieve 70% of vaccination, then antibody will develop and herd immunity will be there. So that will helpful to prevent infection. But there is no such category that that vaccine will for the means COVID warrior, for the 65 age, for the 18 age, because in second wave everybody is getting infected and young people 27 to 40, 50, they are dying like anything. I have seen in my hospital how people are dying. So it is not that segregation, it is vaccine for all and it should be a community and cluster vaccination. And once they are identified and screened, so they will get vaccinated at the local center, at the community, because mostly the urban people are getting infected. This time they've gone to villages also, but that severity of infection in villages is very less in comparison to urban area. So urban people should be vaccinated and they will not travel to village to get them infected again. So this is my viewpoint, the utility of vaccine. But still, double masking, hand washing, sanitization. If you are touching any unknown object or new to it, wash your hand, put double mask, keep social distancing. That is the key for success to prevent the pandemic. Thank you all.
Thank you so much, Dr. Akshay, for taking time out from your busy schedule. I know all of you are very busy helping people fight COVID. Thank you so much for putting your thoughts in front of us. And moving on, I would like to invite Dr. Devendra Kumar Machi, Director of Ambedkar Foundation, New Delhi. So, we hear your thoughts on this topic.
Good evening, everybody, and good morning to those countries where this morning. And of course, it's in Australia, it's midnight. And welcome to this program. And thank you, Smrutira Odisha International, for inviting me to this program and organizing this program webinar. It's a very interactive session. So, in fact, today's topic is COVID-19 vaccines utilities in India. Though this program has been organized by the international trust like Smrutira Odisha, but the topic of discussion has been confined to India. I find some relevance and merit in it. By utilities, I mean two components to the vaccination program. One is the benefits of the vaccination program. The second is the side effects. And for the benefits, as the previous speakers like Dr. Bera, Dr. Senapati, and Dr. Akshay Raut, and Dr. Nalinipati, many of the doctors also, they spoke about the clinical part. But I will be giving more stress to the non-clinical part, the social part, which has been touched upon by Dr. Joshi and Dr. Raut as well. And Dr. Ashok Chaudhary also, he spoke about that part, IEC component, information, education, and communication component. Here, regarding the side effects, I'll confine my take to the information component. And information, I would rather say, the side effect of this COVID pandemic period in terms of information is totally spread of misinformation. As Dr. Raut was telling, how the information of getting vaccinated may result a person unproductive. Sometimes the misinformation is spreading that it may cause death. Even among the educated people, this is spreading everywhere because there is no foolproof system till today. The information is coming from different parts, from different sides. Even we question the veracity or authenticity or the merit of Covishield versus Covaxin. So if among the educated masses, there is a question mark, then talk about the people who are the fringe of the society, who are very, very vulnerable, who are not educated, who entirely depend on the educated masses. So here the component of information or misinformation, as you put it, that comes to the picture. Now talking about the spread of information or the misinformation, see how the information is penetrated through social media to the rural areas and how the people, they are getting the information either from the mainstream media, either in the Hindi or English. And when a person, half-educated person, roaming around the village, he translates or communicates that information. You just see how the information comes from the sources, and even if the source is authentic, like WHO or the health ministry or the health practitioners, health professionals, but the time it reaches the target audience, see how that information is getting the formation, like in what form it is being perpetuated. So my take is that this is the side effect of vaccination. And the major chunk of the society, the major population of the society, they are at the fringe element. How this authentic information to reach the target audience, the target population, that is the major concern. And the vaccination part, no doubt, the medical professionals, they will be taken care of. Thank you.
I can't agree more, Dr. Devendra Machi sir. This reminds me of a game that's called Chinese Whispers, where the original word does not turn out to be the one that actually the listener gets to hear. So yes, the media has a huge role to play, and they must understand that they should put their differences and political interests aside and serve the people instead. So yes, thank you so much for your time and your words. Moving on, now I would like to invite Dr. Alok Lodh, CEO of Utkal Hospitals Private Limited, Odisha. So over to you. Dr. Alok, are you on the call? Okay, sure. Moving on, can I have Dr. Pareen Somani, who's the chairman of countrywide, worldwide Smrutira Odisha Trust, and we would like to hear you, ma'am.
Hello. Namaste, everyone. Thank you very much, Pallavi, for the lovely introduction. I would like to thank Dr. Rajnikant Mishra, founder and the National Secretary General for Smrutira Odisha International Trust India, and the organizing team for inviting me here to share my knowledge on how to take care of COVID-19 for ourselves and for everybody in this pandemic. Amongst many ministers have joined from the different fields and all the dignitaries who are the part of this webinar. Before I start, I would like to say on behalf of the global mankind, I would like to pray for all the departed soul for their eternal peace. Jai Jagannath. We all know that COVID-19 pandemic has affected individually globally in a multitude of aspects, including socially, economically, and globally, and politically. Individuals in societies around the world have been challenged substantially. Governing bodies around the world have implemented strategies aiming to keep citizens safe from contracting the virus, including lockdown measures, social distancing, personal protective equipments like masks, and good hand hygiene. Many minds in societies have been conditioned to forget the positive and dwell on the negatives. We are constantly being aware of the global statistics linked to the pandemic, which is creating much negativity. It is a role of our governing bodies and health professionals to keep updated with the number of positive cases and educate us on how best we can protect ourselves and others. However, I believe that it is our job to reduce the statistics and not to dwell on them. The way we can do this by being aware of by washing our hands regularly, wearing a mask, and social distancing. However, we must be positive in our approach. For example, we should not keep on saying to each other, wash your hands, otherwise you'll be infected. This is affirming negativity. It is like saying that if you don't cross the road carefully, you will be injured. Rather than saying, please cross the roads carefully, you will be fine. The negative word of injury must not enter our minds, because through this we invite injury. Therefore, we should only think positively. What we think and speak will manifest. As our thoughts turns into action, whatever we think, we attract. If we think negativity, we attract negativity. If we think positivity, we attract positiveness into our lives. Therefore, we must not go and we must not think of negativity. We must let go negativity and attract positivity. We should cultivate positivity in our minds and our hearts while practicing positive affirmation through our words every day, being mindful of vocabulary that we choose to use. Therefore, we should follow, first of all, government guidelines, simultaneously believe that we are safe. Yes, we are safe. We all have this ability to spread that positivity to others through our thoughts, our actions, our words. We need to transform the way that we think. This will help us to alleviate our fear. Our thoughts are very powerful. Remember, our thoughts are so powerful that whatever I'm talking to you, whatever I'm saying to you, all my listeners, all the viewers who are on this dais today, who are attending this conference, who are on this webinar, they all are very powerful. They know what exactly my next sentence will be. And it is through our positive thoughts we believe we can achieve success. We need to focus on this aspect of life that we want to become true and believe them to be true. Through the power of positive thinking, we can change ourselves and society. We have the power to create positive energy which resonates at a high vibration through which we can spread happiness. It is very, very important for us to eat balanced diet, drink enough fluid, which is between 6 to 8 glasses per day, and exercise for only 20 minutes per day. We human beings are social animals and strive to be around each other. We want to be around our family, our friends, our loved ones. Therefore, make sure you use the technology and a video call for our loved ones to be connected. Make time for your hobbies and doing activities that you love to enjoy. Our world is slowly transforming. We are evolving into a new normal society where things as we know it may never be the same again. We must embrace this change together. We have the power. We have the power within ourselves to facilitate good change in the world. I want to share you 3 important messages that I feel has helped me and will help our transformation. Number 1. Always be positive. Never fear change, because every night turns into a new day. With a positive mental attitude, we can create a positive change. Remember, Rome wasn't built in a day. Number 2, seek the strength from inside yourself. Use this inner strength to create positive energy and create a positive opportunities to build a better future. Through your resilience, help other people's background, ethnicity, social, political, or religious lookouts do not matter. Remember, we are all one. We all have been together in this pandemic, and we are all coming out together stronger. Number 3, respect each other. Seek to resolve differences through understanding diverse viewpoint. We all have a key role in society. We all are the master of our own destiny. This is our world. This is our country. Yes, we can change the world. Seek to be the change you wish to create in this world. And it is only by working together we can make a positive global change. Jai Jagannath and namaste to all of you. Thank you.
Thank you so much for the very inspiring speech, Dr. Pareen ma'am. Absolutely, we all must help each other get through it by spreading positivity. So thank you so much. And moving on, can I have Mr. Rabindra Nath Behra sir, who is our senior trustee, Smrutira Odisha, to say a few words. Sir, over to you.
Jai Jagannath. Good morning, good night, and good evening across the globe. Thank you, Smrutira Odisha, for inviting to share in this August platform. And the topic is very beautiful regarding COVID-19 vaccination utilities. Our galaxy of leaders here, present, our health leaders and others like Dr. Devendra Maji, Dr. Pat Joshi, and the health leaders like Dr. Nalini Pati, Dr. Chaudhary, and Dr. Akshay, and Dr. Behra, and so many have already spoken, and recently Dr. Somani has already spoken. So lots of thoughts of discussion has been made. So I don't want to add on much more to this. But the thing is that now we are in a pandemic stage of COVID-19. Still, though we are in a confused state that whether COVID-19 is a disease or a biological weapon, and the world is fighting against them, and the world is it is under investigation that whether what is COVID-19, whether China has a role or not. All these things has been under investigation. Still, we are fighting. But there is a say that every place in India is a urinal, and every person in India is a doctor. So that we are really experiencing in this COVID-19 pandemic stage. Everybody is advising. Instead of doctor, everybody has become a doctor here. Means the general people, the IS officers, you put on the TV, everybody is advising on COVID-19. thing is that COVID-19, as per my experience, is a very, very complex problem because everybody is telling COVID, if you have corona, then you self-isolation. But the thing is that your COVID means COVID with hypertension, COVID with heart problem, COVID with the diabetes, COVID with all other kidney problem. There is a complexity of there. So many doctors are there. They can better advise. So these are the things I have questions that it is properly investigated. What steps I have to take? A COVID patient can go for home isolation, but a COVID patient with heart problem, with kidney problem. So there are different type of things that I have talked with one doctor in AIMS here. That he told that we are treating everybody, but COVID-19 knows whom to kill, whom to save. That is its reaction. So you think this is the stage? Doctor has raised their hand that only Lord Jagannath can save this, because people have money, people have facility. Even our Rajya Sabha member and the eminent personality, world personality, like people has lost their lives because of the this COVID-19. So these things has to be taken into consideration. Then what about COVID-19 vaccination? Vaccination is a mystery now. The cowin.gov.in. So you will never get it any appointment in cowin.gov.in. How it is, there the registration is done. That is a milestone. Whenever I open it, it is booked. It is booked. It is booked. So thing is that should be open. You can clearly say we have only this much of vaccines and we can plan accordingly. But every time we cannot open this, the site is open, but it's not there. So that is second thing. Another other areas, the age group. Already speakers, doctors have already spoken that age group 18 to 45 and above. So what about health workers? Then other important persons that should be properly filtered, and who should be given first vaccine, that should be taken into consideration. That a COVID-19 vaccine utilities program, whatever say, that should be taken into consideration, and that should be zero politics and zero tolerance on this area. That should not be. Earlier there is a comments that this is Mr. So-and-so vaccine, it will not work, people will die. So this misinformation has been spread. So this awareness NGOs has a greater role. Smrutira Odisha and all other NGOs I actually invite, they should have a greater role on this to spread the correct news about COVID-19 and this corona during this pandemic. And others that the real doctors, original doctors should come into the actual TV. They should advise proper. They should give proper advice. As Dr. Nalini Pati has told about mask, that is a common question. Actually, if using misusing the mask, it will spread more virus than using the mask. But it is better not to use, because outside the layer it's already gloves is similar type of thing. Outside the gloves, outside the mask, there are lots of concentration of viruses. So that will, if you touch it, you should every day, whether you should wash the mask every day or not. So many questions are there in my mind that should be taken into consideration. So vaccine is a big challenge. And second is, what is the time frame of the vaccines? Whether it is 1 month, 2 months, 6 months, 1 year or 2 years, because already I have heard that third layer, already it is that third layer is coming. So we don't know whether fourth layer, second, fourth, fifth, sixth will come or not. But this is a big question. But thing is that we should be prepared for this. How many days the vaccine will function? What is its longevity? Then if one has taken first dose, then COVID is affected by COVID. Then when you should take the second dose? That already government has declared that after 3 months you can take. So these are the things, are questions we should be taken into consideration. Now the world is fighting with COVID-19. Today I have come into another thing is that the world is going to fight against alien. See, alien is going to, even if the entire world can crash. So these are the big challenges coming in the news in our future. So we should prepare for all type of things and we should overcome this. So the vaccination is there. It should or should not be. We should follow what you say, the proper sanitation, proper hand wash, and proper gloves or mask use. That is the, and social distance is just misnomer. It's meaningless social distance, because the vaccine centers are the hotspots of spreading viruses, COVID-19. Because 6 feet, who will maintain 6 feet distance? Practically, physically, it is in a situation. So all these things you should take into consideration, and how many times and when India can complete such a big and vast country, when India can complete this vaccination program, and what is the longevity of vaccination program, that is a big question. That all these things should be taken into consideration, and our health leaders, they can better ask, and government can take a better decision in this area. Thank you very much. Thank you all. Thank you, Smrutira Odisha, for inviting me and sharing my views. Thank you. Namaskar. Jai Jagannath.
Thank you, sir, very much for your words. And yes, I do agree. Even whether it's a biological or not, one thing it has done is brought humanity together to fight it. So I just hope that it does not end up dividing us, but ends up uniting us. Yes, moving on, I would like to invite Dr. Arun Kumar Raj, who's from Bahrain and the president of the Odia Samaj. So, sir, can we have a few words from you as well? Dr. Arun, are you on the call? Okay, I believe Dr. Arun is not in the call at the moment. Moving on, I would like to invite Ms. Anita Sundarajan, ma'am, who's a social activist in the UK, and I'm looking forward to listening her point of view on this topic. Thank you.
Hello, thank you. I'd like first of all to thank Mr. Rajnikant Mishra for inviting me to this forum, and also Smrutira Odisha, and hopefully I'll be working with Smrutira Odisha in the future, because we have a NGO here and we'd like to coordinate with you guys there. As far as the COVID vaccines is concerned, I think NGOs can play a very large part in actually trying to mobilize all the public to take the vaccine, because as everyone says, there is a lot of misinformation going on. People say it's going to change your DNA. I mean, that is people here in the UK. So I don't know what kind of misinformation you have in India. It could be totally different, but everyone has their own views on what this vaccine is going to do to them. But it is very important that everyone does take this vaccine and you get herd immunity. So I think NGOs can really play a huge part. And also, I feel there is a big social divide on who is getting the vaccine and who is not. Because I've seen a lot of the people who are middle class and upper class, they pay for the vaccine and get it. They could be 18 years, they could be 25, 26, they get it. But what is not taken care of is all the vulnerable people should be given it first, and that is not taken care of. And then it has to come down the age groups. So all the 60 plus, and then you come down further. For example, now in the UK, now they've come down to the age group of 32 plus, and all of them are getting their second vaccines now. Yes, I understand it's totally different in India, but the age groups have to be taken care of, and you have to say that certain age groups have to wait before they can get their vaccines. I think that is really important. And the other thing I wanted to talk about was, yeah, I mean, I do not, I mean, I think the capacity for the vaccines, I don't know what currently, what is the situation there, whether they're increasing the number of vaccines being created, or is it the production is still the same? So that kind of information we do not get so much in the UK. So it'll be good for someone to give us that information. And I don't really want to take too much of time because I think we're running out of time. So thank you very much.
And thank you very much for the crisp, concise point of view. I believe you summed it up very beautifully. Thank you so much for your time. And thank you for respecting the other speakers' time as well. Dr. Raja Rao, sir, the founder of the World Peace Commission. Yes, sir, please.
Thank you, ma'am. Thank you so much for the wonderful opportunity.
I believe you are on mute. Would request you to unmute.
Thank you, ma'am. Thank you so much for the wonderful opportunity to speak. Coming to COVID-19 vaccines, I want to add only 1 or 2 points with regard because very pathetic situation that we are facing today. Really, it can be prevented very easily. We could have saved millions of people from their premature death, but it didn't have happened due to lack of mismanagement of this COVID-19 crisis. Last year, when we witnessed the migration of migrant workers, that was a very pathetic situation in the year 2020 regarding this COVID-19 pandemic. In 2021, when dead bodies are floating in the river, that's really absolutely one more pathetic situation that our nation is receiving at this current scenario. So, at least if we take proper care at this time, just needs a proper strategy, because all nations in the world started accepting India as Vishwaguru. At this moment, we have fallen to a least level due to this scenario of pandemic, because it made a disaster. It's a really man-made disaster, because we have got already our vaccines. We have got vaccines, and we have even imported vaccines to several nations. But the unfortunate thing is, when we are able to protect millions of people all over spread in the world, but when time comes to our people, we were unable to help. There are so many people that are speaking, one particular population, but one more is how can we do that? But it is not the correct answer. It's not one body, but there is a system. There is a system in our India. There are several prime ministers, governors, IAS, IPS officers. There are several systems that are there in India. If all come to on one platform, it will become a mighty platform to help everyone. Even it's not 130 crore population, 150 crore population. If priority is to help people, certainly we can help. But unfortunately, our priorities are different. So we are going for monuments, we are going for vistas, we are going for whatever the manual things that are there, we are going for them. But very pathetic situation at this moment. At least even all chief ministers sit together with our prime minister if they have a proper plan, because chief ministers accusing central government and the central government is accusing chief ministers. But you know who are dying? The people are dying in the streets and dead bodies are floating in the rivers. We are unable to provide a dignified death to the people. So such a pathetic situation now at present is prevailing. So from this platform, I request the government of India help people with a proper strategy, because we have manpower, but the lack of the thing is we don't have coordination among all the systems. So the system should be established first. When there is a system, so who can pool the vaccines? The clarity will come. I mean, Kejriwal directly saying that we don't have anything to pool. We are unable to get vaccines. So such a way, even we can see the Kerala chief minister, he is writing letters to non-BJP governments that we should unite to ask questions about central government. So this is the present scenario. So this scenario should be changed, or should stand on one platform. So people welfare should be the top priority. When politics comes second and people come first, certainly there will be an answer. With that answer, we can save millions of people that are going to die. So it still we have time. I think experts are guessing that the third wave is going to affect us soon. So at the juncture, I request the government, I request all government officials, I request all the chief ministers, I request all the politicians, MPs, MLAs, please sit and make a plan. We have hundreds of MPs, we cannot see nowhere. But if elections come, if corporators come into every street and they do their part. But it's not elections, people are dying, it's more than that. So I request all leaders should take initiative in curbing this pandemic. So if our government, with all chief ministers, they sit together and plan it, it's not 130 crore population, even we can provide 230 crore population also when we have this strategy to do that. So with this, I want to conclude, because everyone is giving advice to people, but we have our government. So people are doing already their part because they are living with fear. People are living with fear because they are not going to die because of pandemic, but they are about to die because of starvation, because of fear. So we have to help people with a dose. Here, dose means a vaccination. So that can help us a lot from preventing that third wave of pandemic. So with this, I want to say thanks to the organizers for giving me this wonderful opportunity. Thank you so much.
Well, thank you so much for those words. Yes, our government should not forget that it is by the people of people and for the people. So, all right, moving on, I would like to call upon Dr. Chidatmika Khatwa, Director of Ashushuta Hospital. And ma'am, are you there on the call?
Yeah, namaskar. Namaskar, this is Chidatmika. I cannot on my video. I was hearing this amazing speakers. Thanks, Smrutira Odisha, for organizing this beautiful seminar. In fact, I'll say that this is a need of the day. I'll say a few things like this is the timing is to for the practical implementation of the program, and it's not only the responsibility of the government. It's the responsibility of every individual. I'll say is MSR is my social responsibility. It's not only CSR, corporate social responsibility. So now we have been in daily basis dealing with the COVID, patient, what is happening, what is going on. So you can say that practically every day we are living with the experiencing the COVID. So I'll suggest few things like it's a definitely challenge for the government of India. And I think it's a global challenge, I can say, to save each and everybody's life in this pandemic. So government has to work footing, I can say that work footing give the instructions or channelize the manufacturings of the vaccination, because that's a challenge, because we have been talking to the Odisha government also how to channelize this vaccine. But big challenges is not available. Whenever we are talking to the government, BMC, like our Bhubaneswar Municipal Corporation or Health Ministry, they're saying that sufficient vaccine is not available. So when we know that the vaccine is the only alternative, rather taking the proper masks and sanitation and all that, vaccine also a major factor to save the life. So that this moment, I think the government has to take a very, very, very drastic step to give the instruction and channelize to massive production of the vaccination and shuttle around and do the logistic with channelizing with various corporates to reach out, because COVID will not see the reach of poor or child or young or old. So it is a challenge now. Government has to produce the massive vaccination and to shuttle around and I think ensure the home vaccination. Because last time what happened, a few of the speakers and doctors, they have been talking that there are so many misconceptions that vaccine will take their life. Vaccine will put them this, vaccine will side effect. So this parallelly, with the vaccination, the education, the knowledge, that, okay, this vaccine will save your life. It's not going to be, there is every medicine, like Dr. Nalini said, Dr. Akshay Raut also said, that there is any medicine has got little side effect, because I have heard that after vaccination, somebody is getting fever. So that's okay. That's okay, because this is a question of life. So we have to be, see that government has to channelize, and it should be in a PPP mode, in a public-private partnership. Government has to be call upon the CSR, the big corporates like Indian Oil, this Tata, everyone to put it in one go. Loop in, then only this massive drive vaccination can be possible and reach to each rural. And simultaneously, they have to also ensure to, because the rural people are not techno savvy. So they have to also see that how, they can educate to do the registration. Because in Odisha, I have associated with the government of Odisha Social Security Department. We have around 6,000 people who works in the grassroots level, reach out each and every household in the name of PAG, People Access Group. So this type of channelization has to be there. Door-to-door education and door-to-door vaccination has to be properly made, take the step by the government in a ward footing. And secondly, as all doctors said, that people are wearing here masks to, they are scared about the police. People will, they will do a stick on them. But which is, they have to understand that proper, if you are not tying the masks on your neck, you have to cover your face and, your mouth and nose. Proper masks. People are not putting. That also aware has to be there, awareness. Then I think it's not a social distancing, I'll say physical distancing, because socially we all are connected. Stay positive. I think the previous speaker was saying we have to stay positive. I myself is a COVID survivor. I've seen, I think rather taking the medicine, the doctors, the paramedical staffs talk that time. They work like a vitamin to us, we get motivated to fight back with the COVID. So that each and every hospitals also have the responsibility to, make the patient very motivated, very positive, so that they can recoup very fast. So these are my suggestions, I'll say, because it is a time to implement towards the solution. Stay blessed, stay positive. Thank you very much.
Thank you, ma'am, for those fantastic words coming from a COVID survivor. And I hope you return to your 100 or 200% of energy very soon. Thank you so much. Moving on, I would like to invite Mr. Mavendra Sharma, Rashtriya Parashuram Shariman Sena, West Bengal. So, sir, can we have you say a few words? So are you on the call, Mr. Mavendra Sharma ji? All right. Hello, Mavendra Sharma ji. I think you're on mute. क्या आप अनम्यूट कर सकते हैं अपने आप को?
Sure. जय जगन्नाथ, नमस्कार सबको। मैं सबसे पहले स्मित्रा उड़ीसा इंटरनेशनल ट्रस्ट को धन्यवाद देता हूं कि ये बहुत विस्तृत, बहुत अच्छा प्रोग्राम उन्होंने ऑर्गेनाइज किया। ज्यादा बोलने को नहीं है, as I have only 2 minutes. मैं जानकारी के लिए बता दूं कि हिंदी is comfortable, I think, to everybody.
जी सर।
थैंक यू वेरी मच। सो जैसा कि मैं आयुर्वेद में जुड़ा हूं, हम लोग पैंडेमिक सिचुएशन की बात कर रहे थे और बात कर रहे हैं कि कैसे इससे हम लोग को नवजात मिलेगा और इसकी प्रॉब्लम क्या है। तो सबसे पहली बात, जैसा कि यूएसए भी मैडम ने बोला, आई एम वेरी प्लीज, ध्यान और अध्यात्म की बात कर रहे थे, शांति की बात कर रहे थे, पॉजिटिव, जिसको हिंदी में बोलते हैं सकारात्मक एनर्जी। बी पॉजिटिव, ऑलवेज बी पॉजिटिव। जहां तक कोविड-19 का सवाल है, हम लोग बोलते हैं इम्यूनिटी सिस्टम, जिसका इम्यूनिटी ठीक है, रेजिस्टेंस पावर ठीक है, उसको ये बहुत ज्यादा इफेक्ट नहीं कर रहा है। तो इसके लिए हम लोग को क्या करना चाहिए? हमारे आयुर्वेद में बोलते हैं अगर हम लोग एक लहसुना, जिसका प्रेशर सब ठीक है, जिसके प्रेशर ठीक है, उसको प्रॉब्लम नहीं है, तो एक गार्गिल अगर रोज खाली पेट हम लेते हैं, वॉक करते हैं, अपनी इम्यूनिटी को ठीक करते हैं। अभी हम लोगों ने जो देखा कि अधिकतर लोग एक्सपायर किए, कोई ना कोई बीमारी कैरी कर रहे थे, या कुछ लोग नेग्लिजेंसी के लिए कर रहे थे। हम लोग बहुत विस्तृत जानकारी में इतना इलेबोरेट डिस्कशन किए कि 2 गज की दूरी रखनी है, गवर्नमेंट है, भारत 135 करोड़ का देश है। वी नो वेरी वेल कि इतने बड़े देश में वैक्सीनेशन लगाना, इतने लोगों के पास जाना, इसके बावजूद भी जो डेथ रेशियो है ये ओवर एंड ऑल लोगों से वर्ल्ड वाइज बहुत कम हुआ। इसका कारण है कि हम अध्यात्म से जुड़े थे, आयुर्वेद से जुड़े थे, और आयुर्वेद जैसा हम लोगों को बताता है कि हम लोग स्पाइसेस खाते हैं, लहसुन खाते हैं, गरम मसाला खाते हैं, तो हमारे देश में ऐसे प्राचीन दिनों से चल रहा है कि हमारी इम्यूनिटी सिस्टम बहुत अच्छा है। अगर भारत के लोगों का इम्यूनिटी सिस्टम बहुत अच्छा है और भारत के लोग थोड़ा सा प्रिकॉशन लेते हैं, डिस्टेंस की बात करते हैं, मास्क लगाते हैं, बिकॉज इट्स इंटरनेशनल इशू। जैसा कि हमने देखा अमेरिका में वर्ल्ड वाइज कितनी डेथ हुई, लेकिन भारत में इतने बड़े देश होने के बावजूद भी हमारा डेथ रेशियो कम है। और अभी भी अगर हम जितने जागरूक हो पाए हैं, वैक्सीनेशन नो डाउट ये इम्यूनिटी को बढ़ा रहा है। वैक्सीन लगने के बाद भी लोगों को कोविड-19 हो जा रहा है। क्यों हो जा रहा है? जो कोई ना कोई बीमारी कैरी कर रहे हैं, जैसे प्रेशर, हाइपरटेंशन, शुगर, और किसी ना किसी को कुछ प्रॉब्लम है, जिसका इम्यूनिटी कमजोर है, उसको ये ज्यादा इफेक्ट कर रहा है। एंड साइमल्टेनियसली अगर हम वॉक करते हैं, योगा करते हैं, अध्यात्म करते हैं, मेडिटेशन करते हैं, और पॉजिटिव, जैसा कि मैडम ने बोला और सारे डॉक्टर ने बोला है, आई थिंक कोविड-19 को साइकोलॉजिकली ये नहीं लेना है कि ये बहुत बड़ी महामारी है। बहुत कम समय में मुझे लगता है भारत ने सचमुच पूरे विश्व में एक शक्ति के हिसाब से बहुत कम समय में एक वैक्सीन का उपयोग किया, जो बच्चों से लेके बड़ों तक को लगेगी और ये इम्यूनिटी सिस्टम को ठीक करेगी। हम वैक्सीन के अलावा भी इम्यूनिटी सिस्टम ठीक कर सकते हैं अगर हम खाने में परहेज रखते हैं, एक लहसुन रोज सुबह खाली पेट खाते हैं, वर्कआउट करते हैं, योगा करते हैं, ध्यान करते हैं, तो और पॉजिटिव, जो मैडम ने बोला, सकारात्मक, बी पॉजिटिव ऑलवेज, कि हम इस कोविड इज महामारी, और ये ऐसा कुछ नहीं है, ये इंटरनेशनली जैसा कि हम बोल रहे हैं, चाइना के द्वारा दिया गया एक डेंजरियस वॉर है। इस वॉर से ईच एंड एवरी सिटीजन ऑफ इंडिया को फाइट करना है। और हम तो आध्यात्मिक हैं, हमारे यहाँ जगन्नाथ है, बंगाल में महाकाली है, हमारे यहाँ तो पूजा पाठ का देश रहा है। तो बी पॉजिटिव विथ नो स्केयर, हम लोग को मेरा एक ही कहना है।
सर आप फिर से म्यूट पे चले गए हैं, शायद आपको किसी ने म्यूट कर दिया।
आई एम सो सॉरी, म्यूट पे हो गया। हम लोगों को अध्यात्म को जोड़ना है, और जो स्पाइसेस चीजें हम लोग खाते हैं, लहसुना खाते हैं, लहसुन हमारे बॉडी को, ब्लड सर्कुलेशन को, इम्यून सिस्टम को बहुत अच्छा करता है। वैक्सीन लेने के बाद भी हमको ये सब करना है। ऐसा नहीं है कि वैक्सीन ले लिया हम निश्चिंत हो गए, मास्क नहीं लगाएंगे, सोशल डिस्टेंसिंग नहीं करेंगे, ऐसा नहीं है। सारे डॉक्टर जितने लोग यहाँ पैनल में हैं मेरे से बहुत अभिज्ञ हैं और बहुत कुछ उन्होंने बोला है। नेचुरली ये एक, मैं तो सबसे पहले डॉक्टर रजनीकांत को धन्यवाद दूंगा कि वर्ल्ड वाइज इतनी बड़ी एनजीओ में एक अवेयरनेस प्रोग्राम, डेफिनेटली इट इज अ रिस्पॉन्सिबल ऑफ द ईच एंड एवरी सिटीजन ऑफ इंडिया कि हम इसको कहाँ तक लोगों को पहुंचाएं, और सावधान रहना है हम लोग, भयभीत नहीं होना। बच्चों से लेके बड़े तक जब हम मार्केट में जाते हैं, मैं भी जाता हूं तो मैं लोगों से बोलता हूं, भाई आपने मास्क क्यों नहीं पहना? आई डोंट केयर कि वो क्या बोलेंगे, लोग एक्सक्यूज देते हैं। आज भी मैं सुबह मार्केट में गया तो 5 लोग मास्क नहीं पहने थे। आई टेल ग्रोसरी शॉप पीपुल, आई विल इन्वेस्ट, नो प्रॉब्लम, आप इनको मास्क दे दीजिए। लोगों को समझाना है कि मास्क की उपयोगिता क्या है, सोशल डिस्टेंसिंग की उपयोगिता क्या है, इम्यूनिटी क्या है। हम लोग देख रहे हैं कि जितने लोग कैरियर में हैं, मतलब कोई शुगर का पेशेंट है, कोई कैंसर का पेशेंट है, वो यंग हो सकता है, ओल्ड एज का बंदा हो सकता है, उसको ये कोविड-19 ज्यादा इफेक्ट कर रहा है। आई थिंक यू पीपल आर वेरी मच अवेयर, और जो मैं बोल रहा हूँ उसको समझ पा रहे होंगे। आयुर्वेद के हिसाब से हम सबको कम से कम रोज वॉक करना है, वर्कआउट करना है, मेडिटेशन करना है, और पॉजिटिव सकारात्मक सोचों को साथ में रखना है। जितने हम पॉजिटिव होंगे, जितने सकारात्मक सोच कर पाएंगे, उतना हम बॉडी को अच्छे से रख पाएंगे। बच्चों से लेके बुजुर्गों तक को बी पॉजिटिव, यही मैं सुमित्रा उड़ीसा इंटरनेशनल ट्रस्ट की तरफ से पूरे विश्व को ये मैं एक मैसेज देना चाहता हूँ। थैंक यू वेरी मच। थैंक यू। जय हिंद।
Jai Hind, Manvendra ji, thank you so much. And we are so lucky to be born in a country where we have a lot of naturally available herbs. So yes, we should take care of our health. And quickly moving on, I would like to invite Dr. A.M.B.K. Varaprasad ji, Chancellor of World Health University, a few quick words from you as well. Dr. Varaprasad. Okay, moving on, can I have Dr. Saurabh Pandey, founder Dharadam International, UP? Sir, over to you.
First of all, welcome to all of you who has participated the international seminar on behalf of Smrutira International Trust. I am very happy to join this valuable seminar. I am the famous journalist of India and also news editor and the columnist and chairperson of the Dharadam International. Just now, today's very important theme to importance of the vaccination. Every time, this is growing like vaccine prevention is better than cure. वैक्सीन का तात्पर्य ये नहीं है कि वो हमको पूरा बचा देगा। वैक्सीन का तात्पर्य ये भी नहीं कि हमारे अंदर ऐसा कुछ कर देगा कि हमें वो रोग कहीं से परेशान न करे। वैक्सीन का मतलब यही है कि बारिश हो रही है, हम छतरी लगा लेंगे, छाता लग जाता है, ऊपर का तो सब कुछ बच जाता है। ऐसा ही होता है कि हमारी शरीर अगल बगल से मिली है, लेकिन इसके बाद भी हम सुरक्षित रहते हैं। इसलिए आप सभी से निवेदन है, और यहाँ तो सारे प्रबुद्ध बैठे हुए हैं, प्रबुद्धों के बीच में कौन सी ऐसी बात की जाए कि जो नई चीज हो। इस जो बातें हुई है
I still think there's some issue with the internet, sir. I hope it's just not. I believe there's a lot of internet connectivity issue at Dr. Saurabh sir's end. So I think we can move on at the moment till he's back. Moving on, can I have Ms. Sheila Sharma, social activist from Mumbai, saying a few words. Sheila Sharma ma'am, can you please unmute yourself?
Good evening and Jai Jagannath ji. पहले तो थैंक्स बोलूंगी मैं मिस्टर रजनीकांत जी को, जिन्होंने इतना ग्लोबली इतने सारे लोगों को इन्होंने एक साथ एक प्लेटफॉर्म के नीचे जोड़कर उन्होंने कोविड वैक्सीन के लिए जो किया है, आप लोगों ने इतना अच्छा सब बताया है, इसके लिए मुझे बोलने के लिए तो इतना तो है नहीं, लेकिन फिर भी मैं अपना व्यू रखूंगी कि मेरा कहना ये है कि कोविड वैक्सीन में सब कुछ शुरू तो किया इंडिया में बहुत, लेकिन मुझे लोगों से एक ये रिक्वेस्ट है, मुझे गवर्नमेंट तक भी पहुंचाना है और मैं कर भी रही हूँ ये कोशिश कि अभी वो लोग सिर्फ 45 प्लस के लिए कर रहे हैं। और मुझे उनको ये बोलना है कि जैसे जो बच्चे हैं 18 प्लस हैं या उनसे छोटे, ज्यादातर आप देखिए जॉब पर या काम पर या कहीं भी आप मॉल में या कहीं रास्ते, ज्यादातर यंगस्टर वर्क कर रहे हैं। इस समय ऐसी सिचुएशन है जिसमें सीनियर सिटीजन या 45 प्लस ज्यादातर घर में रह रहे हैं, बहुत कम लोग काम कर रहे हैं, ज्यादातर बच्चों को भेजा जाता है। आप देखिए अगर हमारे यहाँ सोसाइटी में भी अगर क्लीनिंग के लिए भी कोई आता है या वॉचमैन वगैरह भी, मोस्टली वो लोग 35 के अंदर हैं। तो मुझे रिक्वेस्ट ये करनी है कि वैक्सीन अगर लगा रहे हैं तो प्लीज रिक्वेस्ट है आप लोगों से कि आप जितनी जल्दी हो सके वो 18 प्लस वालों के लिए करिए। और जैसा कि हम लोग को बता रहे हैं, मास्क जरूरी है, सैनिटाइजेशन जरूरी है, 2 गज की दूरी जरूरी है, हम लोग सब पालन करते हैं। लेकिन कभी कभी क्या आपने सोचा है, अगर हम कभी मार्केट में जाते हैं या आप देखिए जैसे हम लोग को न्यूज में भी दिखाते हैं कि जब लोग सब्जी मंडी जाते हैं या फ्रूट्स मार्केट जाते हैं या कहीं जाते हैं, आप देखिए वहां पर कोई भी किसी चीज का पालन नहीं होता है, ना कोई मास्क पहनता है ना कोई कुछ करता है। अगर आप उन लोगों को बोलते हैं तो उनका सीधा सा जवाब ये होता है कि अगर हम ये सब करेंगे तो खाएंगे कहाँ से, हमारा ये कमाने का है, मैं मास्क लगाऊं या इतनी जल्दी इतना क्राउड है, मैं पहले अपना सामान देखूं या जो चीज है वो खरीदूं। तो इसके लिए अगर हम ये सब चीजों के लिए कर रहे हैं तो मुझे लगता है हम सबको मिल करके इसके लिए भी कुछ ना कुछ सोच करके और कुछ ना कुछ करना पड़ेगा। तो बाकी तो सब आप लोगों ने बताया है, तो मैं आप सबसे भी यही निवेदन करती हूँ कि हम सबको मिलकर इसके लिए एक कदम उठाएं। पहले हम लोग गवर्नमेंट को बोले जितनी जल्दी हो वो आप प्लीज 18 प्लस के लिए करिए, क्योंकि अभी जो वैक्सीनेशन लग भी रहा है ना, देखिए हर इंसान मिडिल क्लास है, 1.5-2 साल से लोग घर में बैठे हैं, लोगों के पास काम नहीं है। और अभी जो उन्होंने वैक्सीनेशन शुरू किया है वो भी प्राइवेट हॉस्पिटल में किया है। प्राइवेट हॉस्पिटल में आप देखिए 950 रुपीज का 1 इंजेक्शन है। किसी के अगर 2-3 बच्चे हैं या इतने कम एज के लोग हैं फैमिली में तो वो कैसे अफोर्ड कर सकते हैं। तो प्लीज आप सबसे हाथ जोड़ के विनती है कि हम ये सब तो आपने बताया, सबने सुना, हम लोगों ने भी सुना, हम वो सब केयर करेंगे, बट आप लोग इसके लिए भी हम सब मिल करके अगर एक कदम उठाएंगे तो मेरे ख्याल से बहुत अच्छा होगा। थैंक यू सो मच। थैंक यू रजनीकांत जी, थैंक यू सो मच।
Yes, ma'am. Thank you for bringing that very crucial aspect of COVID up, that it has hit a section of the society very hard, and we all must work together to help each other once again. Now we have a couple of COVID warriors who have joined us to let us know their experiences and any suggestions or how exactly did they, what their journey was. So I'd like to invite Dr. Kavita Rao, who is and Mrs. Smrutira Nayak to come ahead and tell us about their experience. Over to you, Dr. Kavita Rao. Okay, I believe Kavita Rao ma'am is not on the call. Can I have Mrs. Smrutira Nayak? Okay, I believe Smrutira Nayak ma'am is also not on the call at the moment. So yeah, before we move on to the vote of thanks, I would like to call upon Rajni sir, who we did not get to hear at all. Sir, आपके speech के बिना ये incomplete होगा, तो please over to you. Rajni sir, please unmute yourself. Dr. Rajni? Okay, I believe we still have internet connectivity issues. Hello?
Yes. Hello. पल्लवी?
सुनाई दे रहा है।
ठीक है, प्रोग्राम खत्म हो गया?
जी सर, जस्ट वोट ऑफ थैंक्स बचा है। हेलो
हेलो।
हाँ, यस सर, वी कैन हियर यू, प्लीज गो अहेड। हेलो,
my network is slow. Hello.
Yes, we still can't hear you clearly, sir. Sorry. It's very inaudible at the moment.
Hello.
Hello.
Okay.
Yes, sir.
Hello.
Please go ahead. हाँ,
सुनाई दे
आपका
रहा है?
बैंडविड्थ लो
सुनाई दे रहा है ना? सुनाई दे रहा है?
हाँ 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 बोलिए, सुनाई दे
अभी
रहा है,
सुनाई दे
बट
रहा है? अभी
आपका
सुनाई दे रहा है?
नेटवर्क थोड़ा स्लो है तो कट रहा है बीच में। हाँ सुनाई दे रहा है, आपका इंटरनेट थोड़ा स्लो है तो कट हो रहा है।
इंटरनेट थोड़ा स्लो है, इंटरनेट थोड़ा स्लो है मेरा।
हाँ 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 एग्जैक्टली। तो ये
एक मिनट।
सर कुछ सुनाई नहीं दे रहा है अभी। हेलो सर, नेटवर्क काफी खराब है। आई एम सो सॉरी, कुछ सुनाई नहीं दे रहा।